we are mindful that we are here at an important juncture in the history of this pandemic, this disease. And while it's absolutely true, and I appreciated the comments, that California is leading the nation in terms of doses administered. Over 43.5 million doses have been administered in this state, 17.6 million more than any other state. We are mindful of the increase in positivity rate. We're mindful of the efficiency of the Delta virus. We're mindful of the increase in case rates and hospitalization rates in this state because too many people have chosen to live with this virus. We're at a point in this epidemic, this pandemic, where choice, individuals' choice not to get vaccinated is now impacting the rest of us in a profound and devastating and deadly way. That choice has led to an increase in case rates, growing concern around increase in death rates, and self-evidently around hospitalization rates. But as it relates to leading by example, 246,000 Californians are state employees. 246,000 Californians should be vaccinated. And if they're not vaccinated and cannot verify that they've been vaccinated, we are requiring that they get tested. California is committed to vaccination, verification, and or testing on a weekly basis. We're not stopping just with state employees. Today, we're also announcing partnerships that include those like Kaiser, private sector now stepping up, organizations representing physicians and dentists, dialysis clinics stepping up, private sector clinics are committing to the same. Our application implementation of these new requirements that will go out under a health order in the state of California begin on August 9th and are implemented through August 23rd. And we hope this example of public and private leadership as it relates to vaccine verifications, vaccine mandates, and or mandated testing 1 to 2 times a week with also commensurate PPP, or rather PPE obligations as it relates to protective gear, N95 respirator masks as an example, will lead to others to replicate this example in the private sector. We are now asking for that verification, no longer requiring or rather encouraging self-attestation. This is a requirement to prove you've been vaccinated, and if you have not, you'll be tested. And so we are sincere in our belief and desire that we need to step things up at this stage of the pandemic. Our projections are sobering. Our projections over the course of the next number of weeks will show a significant increase in hospitalizations if we continue down this path. But we are exhausted, respectfully, exhausted by the ideological prism that too many Americans are living under. We're exhausted by the Ron Johnsons and the Tucker Carlsons. We're exhausted by the Marjorie Taylor Greens. We're exhausted by the right-wing echo chamber that has been perpetuating misinformation around the vaccine and its efficacy and safety. We're exhausted by the politicalization of this pandemic, and that includes mask wearing that has been equated to the Holocaust. It's disgraceful, it's unconstitutional, it's unconscionable, and it needs to be called out. It's choice to live with this virus. And with all due respect, you don't have the choice to go out and drink and drive and put everybody else's lives at risk. That's the equivalent of this moment with the deadliness and efficiency of the Delta virus. You're putting other people's, innocent people's lives at risk. You're putting businesses at risk. You're putting at risk the ability to educate our kids by getting them back in person full time for in-person instruction. No more Zoom schools. We want to keep our economy moving. We want our small businesses on their feet. Your choice not to get vaccinated and to listen to these pundits that are profiteering off misinformation, intentionally misinforming you, comes at a real societal cost. And so forgive me for being pointed, but it's time we call that question and call some of these people out. And that's, again, the spirit that brings me here today